everything.
Feeling ill? You're not alone.
And I got sick too, so there's a lot of sickness out there. It hasn't gone away.
That's Guam's epidemiologist Dr. Ann Pabutsky during today's COVID-19 public health briefing. The discussion comes as the CDC surveillance has shown an increase in RSV detections and RSV-associated emergency department visits and hospitalizations in multiple U.S. regions, with some regions nearing seasonal peak levels. The CDC alerting clinicians and public health professionals should be aware of increases in respiratory viruses, including RSV. The reports during the Burr months have shown significant increases in people, most especially children, getting sick.
We saw a lot of influenza in the third quarter. We're still seeing a lot of influenza.
Local data for the flu growing from 7 in the first 3 months this year to 115 in the final quarter, a similar trend for RSV.
Saw very little RSV, and then you see this big jump in the fourth quarter, which is September. It's actually October.
A major spike from single digits to now 104 RSV cases locally.
Stuff we weren't seeing because of COVID.
Emergency rooms at GMH and GRMC also seeing the increase in children and elderly showing up.
RSV has continued its trajectory upward. It's still around. We're just not seeing the ER visits for that. And the majority, actually all of the RSV cases that were reported during this time period are from GMH. And again, most of these influenza and RSV reports are coming from the two hospitals, 80%.
Health officials nationwide monitoring what's being called a tripledemic.
I wouldn't characterize this as a triple epidemic right now. It's nothing like COVID. Even in this fourth quarter, you know, we've had almost 800 cases. We'll probably have 800, probably 900 for this quarter alone. It's nothing compared to what we're seeing. The problem is that the kids haven't been exposed to anything. So when we do see the colds and the flu, and nobody's been exposed to anything but COVID in the past couple of years because influenza was hiding somewhere, and it's now back. And so that's why we're seeing these serious cases of acute upper respiratory infections and the problems with the kids at the hospital. And so we need people to be aware that just because COVID's on the wane doesn't mean influenza has gone away or RSV. It's all still out there, and there's colds going around. So people need to, they know the drill. You guys all know the drill. So wash your hands. Remember the hand sanitizer?
While those are the important reminders, Chief Medical Officer Dr. Bob Leon Guerrero noting there is no vaccine for RSV.
If the COVID continues to drop and the RSV continues to go up, we might do what several states in the U.S. have done, where they call public health emergency for RSV. RSV is not a reportable disease until just recently.